This video presents information relevant to physicians and other healthcare providers and highlights their influence as agents of change for promoting health and tobacco-free lifestyles. Whether you're a healthcare provider who works in primary care or have more specialized training, you play an important role in the lives of your patients, your community, and society as a whole. The foundation of a physician's role in healthcare is the patient. Most physicians only see themselves contributing to tobacco prevention and control when screening for tobacco use and providing cessation counseling and medications during a patient consultation. However, the aim of this module is to demonstrate what you can do outside the exam room to support a decline in tobacco use. The first step pertains to the health professionals you interact with every day, including other physicians, surgeons, nurses, dentists, and social workers. By engaging with these professionals, you have the ability to start a conversation about tobacco dependence, effective cessation interventions, and tobacco prevention and control. For example, encourage other physicians to regularly counsel on tobacco use and make it part of their standard care practice. Other healthcare workers can also be responsible for asking and recording patients' tobacco use. Sometimes you'll come in contact with healthcare providers who are unsure of their effectiveness when providing tobacco cessation counseling. However, a meta-analysis that incorporated 28 trials and over 20,000 participants found that brief, 2 to 5 minute interventions are effective in getting smokers to quit. It's sometimes hard for an individual physician to see the results from giving cessation advice, but when looking at it from a population level, differences can be seen. Let's take a look at an example. How many smokers would you need to briefly counsel in order for one patient to quit? Research suggests 35 to 80. Is that number large or small? Perhaps for one doctor, 80 patients seems like a very large number of tobacco users to counsel in order to get one to quit. But if you're in a practice with 10 doctors who are all counseling, then each doctor would only have to counsel 8 smokers until one smoker successfully quits. Compare these numbers with interventions for heart disease. Over a 5-year time period, the number of patients with heart disease who you would need to give statins in order to prevent one death is 83. Also over a 5-year time period, the number of patients with hypertension you would need to give blood pressure medication to in order to prevent one death is 125. To prevent one heart attack, you would need to treat 100 patients with blood pressure medication. Moving up the staircase, the hospital, clinic, or practice you work at encompasses a larger group of health professionals and can create an environment that encourages both patients and employees to partake in a tobacco-free lifestyle. Your only interaction with a patient may be in the exam room, but think about all the other times a patient interacts with others when visiting a healthcare facility. As a patient enters the building, he may register at the front desk and sit in the waiting room. When in the exam room, the patient may interact with a nurse or other professional who gathers basic information and vital signs. Finally, you as the physician consult with the patient. Opportunities exist during each of these touchpoints to implement tobacco control interventions. Here are some strategies. Create or support a tobacco-free environment. Encourage hospital administrators to establish and enforce a tobacco-free policy in and near the facility. This includes prohibiting tobacco use by hospital staff on site. Put posters and pamphlets in areas around the hospital and in waiting rooms to educate patients and visitors on the harms of tobacco and help available to quit. Use a tobacco use identification system for patients. For example, have tobacco use stickers on all patient charts, include tobacco use as a metric on the vital sign, stamp, or form, and include a tobacco use field in the computer information system. Determine roles for each staff member in providing tobacco dependence screening. Establish protocols, guidelines, or a toolkit to help healthcare professionals provide tobacco interventions. and create counseling groups led by a physician or other professional for tobacco users who are trying to quit. Continuing up the staircase, we reach the community level. Apart from interacting with individual patients, hospital staff, and administrators, many opportunities exist for healthcare providers to engage in tobacco control activities in the community at large. Examples include: explore the benefits of visiting schools, community meetings, or local organizations to discuss the impact of tobacco use. Participate in campaigns to establish smoke and tobacco-free schools, hospitals, restaurants, and workplaces. And serve as a subject matter expert in a professional advisory role to educate the public and promote tobacco prevention and control efforts. Finally, the last step to be reached is the societal level. As trusted health experts, healthcare providers can contribute their voice and support for national and global tobacco control efforts, such as smoke-free policies and tobacco price increases. Participating in professional organizations and health professional networks can also provide opportunities to participate in tobacco prevention and control activities at national and international levels. Because healthcare providers practice their profession in the health sector, physicians and other healthcare professionals are seen as experts, role models, and leaders in health, and individuals value their opinion and advice. As a healthcare provider, you can help change social norms by promoting tobacco cessation and living a tobacco-free lifestyle. In closing, physicians and other healthcare providers play an important role in the community and can improve the lives of more than just the patients they personally interact with. By engaging in tobacco prevention and control activities that extend beyond the exam room, your actions can be impactful and contribute greatly to ending the tobacco epidemic and saving lives.